So I'm also very excited about our next speaker. Ken has been making great strides with the Freeslate systems and doing some great work at GSK. He has a long history working in pharmaceutical companies in the pre-formulation space, as well as looking at reaction screening in other areas in drug development. And he's had some previous experience with Symmex and Freeslate systems, and most recently was recruited into GSK to drive their automation strategy. And I think in both how he works with Freeslate and how he works with GSK, he's had tremendous success in implementing that strategy. And so I'm really excited to see what Ken has for us today.
Thank you. Good morning. The three previous talks are going to be pretty hard to top. I think some great science was shown today, and I hope to show you a little bit about what we're doing. Over the past few years, GSK's embarked on an automation strategy. The executive leadership team at GSK has sought to embed automation in the very foundation of the way scientists work. My presentation today will present a small but significant portion of that overall automation strategy. I was initially hired at GSK to set up an automation lab set up to use the Freeslate automation. I have initially been tasked with the ideal that I would set up an automation laboratory and recruit some automation talent, both from within GSK and outside of GSK. We took the delivery of the first CM3, in April 2014. We received our second CM3 in February of 2015. During this period of time, we have completed more than 200 well-plate screens. Each of these are solubility-based, are reaction screening, and those kind of things. During this period of time, we have averaged a 75% utilization rate on that first CM3. So these metrics were really important for us to drive some of our automation strategy. So my presentation today will first discuss the automation platforms that we have in place in the Upper Merion site near Philadelphia at GSK, and then I'll go into some of the workflow packages that we've started to implement. So shown here is our first CM3 that we received back in 2014. This is a typical pre-formulation configuration. So it has a solid dispensing arm that sits here, which can bring tools, the hoppers, the SP and Classic that most of you know very well. We have a set of syringe pumps that drive the heated 4-tip needle, which we use to transfer liquids between the 96 well plate. We have a 4-tip pH probe that we can measure 4 pHs simultaneously in a 1 ml vial. We then also have a wash station, which we can wash those tips, heated and cooled bays, vortexing bay, a powder storage area where the hoppers are stored during the dispenses, and of course, a balance that we do our solid dispensing in. So the GSK Automation Laboratory at has 4 Freeslate platforms co-located. We have 3 CM3s presently and a protege. The first CM3 is that pre-formulation configuration that we discussed earlier. The second CM3 that we got in 2015 is also a pre-formulation configuration, so it has a slight difference between what the first one was delivered. In that we do not have the pH arm here, what we have is a slurry transfer needle that allows us to take slurries from the source plate and isolate them for form analysis. The third CM3 was actually initially ordered for our catalysis group that was in RTP. This is recently transferred up to Upper Merion a few weeks ago. And what we hope to do with this, it was originally configured for the MIPS reactor, so it was metal impregnation system, but we're actually going to divert that hopefully and put the OSR reactor block on this and turn it into a chemistry asset where we then look at catalysis and chemical screening. We're going to put that into a purge box that will allow us to do some air sensitive and water sensitive reaction screening. So some of the analytics that we have in the laboratory, We have a Quantos, which we use for one-to-many solid dispensing. This is made by Mettler Toledo, and we think this is a tremendous asset in our lab, because what we use the Quantos for is dispensing solids for our calibration standards that we use to run on the HPLC to set up the calibration. We have a 96-well scanning Raman that we can actually take the plates after we isolate the solids, put them in there and scan and do Raman analysis. We also have a microscope that we can check those 96 well plates, take pictures, and do birefringence screening for each one of those. And we have ordered a XRD. We can do XRD, but presently what we have to do is scrape the powders off the plate and then isolate them and bring them up one at a time. So we've ordered a analytical XRD that will allow us to do a 96 well plate automatically. So let's talk about some of the workflows that we've been able to define using the Freeslate CM3. So here's a list of each of the workflows that we've started to implement in our laboratory. So we've done the traditional organic solubility that Ku's lab's been doing for a decade. We basically stole that procedure from him. And I'll talk about that in a minute, but I want to go through each one of those. So the next one that we were asked to do is to do biorelevant fluid media solubility. Now, this is important for formulation scientists because what they want to do is see what the solubility and dissolution of an API is inside the body. So we do things like simulated gastric fluid, intestinal fluid, muscle fluid, lung fluids like that. Now, the issue with this is really that the solubility of the APIs are usually very low in the microgram per milliliter. So it's an analytical challenge, and I'll discuss that in a couple of minutes. The next thing that we were taking a look at is how does APIs behave in solubility when you have excipients present? So either a single excipient or mixtures of those excipients. What is the influence on that solubility? So these studies will allow our formulation scientists to make better decisions quicker on their formulation development. Hand in hand with that is our early discovery unit. Would like to understand how to do pH solubility curves in an automated fashion. Presently, they do those by hand. So these are Britton-Robinson buffers that vary from pH 2 to 9. So it's 9 different pHs. And they do a pH solubility curve that allows them to do some predictions for preclinical development. The next workflow that we looked at was actually, we've got all this solubility data, but then we had our scientists coming back to us and saying, well, what form was present there? So exactly what were you measuring the solubility from? So in that, we were isolating the solids and doing Raman or XRD to determine what form was present when the solubility measurements were made. Partition coefficient was really one of the things that drove from, we have a continuous initiative that has started in GSK over the last few years. So we have a continuous processing lab that's next door to us. And incumbent in what they're trying to do is they'd like to do 4 or 5 reactions in a row without having to do much work in between. So what they'd like to do is run the reaction, develop a method that they can do a quick workup, not isolate the material, and take it directly into the next step. So they really need a lot of partition coefficients that allow them to predict how their compounds are going to act in those workups. The traditional polymorph and salt screening, this is where the CM3 started. Back in 2002, Freeslate, at that time with Symix, developed the CM1 to basically do polymorph and salt screening. Now, GSK currently outsources all of their form work, Catalin, which was spun off from GSK a number of years ago. But what we think that this technology can give us is the ability to do more focus screens. If there's a problem or a question and somebody would like to have some polymorph data done on a set that wasn't done initially at Catalin, we might be able to react quicker and get them the data if there's a problem and they need the answer quickly. The last set of experiments that we've been doing on the CM3 is chemical reaction kinetics. Now, we view this sort of like using a sledgehammer to swat a fly, but it certainly you can do it, and I'll show you some data there. But what we think long-term we're going to probably end up doing is doing those kinetic studies on the CM3 to generate the samples and then transfer them to an iChem, which is basically a block heater on an HPLC, and then you can sample those over time. So we think we'll marry the iChem to the CM3, prepare the samples, and then run the kinetic studies on the iChem. So the basic solubility workflow, this is Poo's workflow that he's been running for, I don't know, probably 15, 20 years. But anyways, we take 50 milligrams, we put it into a 1 ml vial, we add a half ml of solvent. We then condition those plates, we stir them magnetically for about 2 hours. We can heat those at whatever temperature we want to have the solubility measured with. At the end of that time, we stop the centrifuge and we stop the stirring and we centrifuge those samples to make a pellet down at the bottom. We then pull using the 4-tip needle to pull up some of the supernatant above the crystal. We filter that in this 96-well filter block, which we think is probably one of the most technologically advanced things that Freeslate's done. It seems like it's trivial to filter 96 different wells in a coherent fashion, but this does it better than anything that I've seen before. The only thing we'd like is to have a 96 needle that could do them all at once, but that's asking for a lot. So after the filtration occurs, we do a serial dilution. We typically use dilute them to 10x into 100x. That's just to give the concentration that the HPLC won't be saturated at. So we then measure the solubility by HPLC. We can then take the slurry that remains after we've done the transfer and isolate them on a 96-well filtration plate, and I'll show you that in a couple of moments, how we accomplish that. But that allows us to check the birefringence of the solid using the microscope and obtain Raman and XRD samples. So I want to show you some of the data that we started to generate. So this is going to be a trend. I'm going to show you some very generalized data that we've done through there. And I think we're pretty proud of some of the results that we're starting to see. So this one was really to calibrate the CMC3 and see what the continuity through a large number of replicates. So this experiment, we did methanol 12 times. And what we wanted to see was what was the average, the standard deviation, and the RSV. So this is key to our strategy. So if you can think about, GSK's got a lot of modelers that sit around and they tinker with their models. And over time, what they would like to do is have a large data set to validate changes to their models. So if you can think of over a period of 10 years, and you have a data set of 15,000 compounds that you have real solubility numbers, they can play with their models, predict what the solubility is, and then go check and see what they really are. So they can validate their models. So this is what I tell people. I'm trying to put myself out of business, because if they can get so good that they can predict solubility, maybe I don't need to do this at all. They can just do the calculation or do a much smaller subset. So I'm trying to put myself out of business with this, but I think it's a great approach. This data is very tight. The standard deviations are less than a mg per mil, and we think that the reproducibility is excellent. We did see a small set of things that were outliers. We can look and use things like t-tests to exclude the outliers in these statistical evaluations, but we knew exactly why these happened. It turned out that these, the filter plate, the filtration paper broke when we were filtering it, so we had to turn down the speed that we were actually injecting the sample into. So the mechanical part of the workflow has been validated, so that was really our first initial run into the CM3. We really wanted to make sure that we could measure them and what the statistical validity of that data was. We do find that there is replication, we have variation in there, so we do see replication errors, but I think that they're manageable statistically, and we typically do between 5 to 10 replicates of each of the solubility numbers. That'll be important in the biorelevant media that I talk about next. So biorelevant fluid is basically stimulated media that mimics a certain part of the digestive tract in human beings. So you have things like stimulated gastric fluid, incisive and passive, which are stimulated intestinal fluids. These mimic the kind of states that human beings, when you take a tablet, how the dissolution and the solubility will do it. So these are very important for our formulation scientists to understand how the API is going to act in these things. The challenge for us is that the API has very low solubility in these fluids, from 0.01 to 2,000 micrograms per milliliter. These are at the edge of detection by HPLC and can be a very swift analytical challenge for us. So what we do is the filtration plate. So we use the filtration block as our first HPLC plate. We'll take apart and take off the filtration apparatus, and then we will put a new plate and a seal over that and put that directly into the HPLC. So we have no dilution of those, and they're directly injected into the HPLC at whatever highest amount of injection volume that we can get away with without making the peak shape too broad. So because of the API solubility, we reduce the API loading to 2 mg. So we can do a 96-well plate, get 96 different conditions or replicates with about 200 milligrams of compound. So this is extremely efficient, and getting 96 solubility numbers for 200 milligrams is a pretty good deal for our formulation scientists. This becomes a challenge when we go into the early development space where they may only have 50 or 100 milligrams of material. But what we do is we can cut back on the number of replicates for that to match whatever availability the compounds have. We have completed more than 100 screens of, in biorelevant fluid, and the next slide will show you some of the examples that we do. Now, initially we were a little perplexed. We were seeing a lot of outliers in the data. So those were showing some, large variations on what we thought. But then once we sat down and took a look at the data, we were asking ourselves, what are these numbers really saying? These numbers are saying that the solubility average is 0.26 mg per mil, and the variation is 0.028 mg per mil there. So that's not bad. And if you take a look at the averages, and even if we don't exclude the outliers, it's 260 micrograms per milliliter. This is good enough. So it's fit for purpose for our formulation scientists. And we've validated this data. We actually have done these by hand and measured these. And typically the way that it's done by hand is, if you've got to do it by hand, you're not doing 5 or 10 replicates, you do it once. So it's really hard for you to get a statistical look of, well, how well are you doing there? When we did that, we actually went in the lab and did 12 replicates by hand. The variations were very similar. There were not any difference between the manually obtained values than what we were getting. So the next solubility workflow that we did was pH solubility. So our early development scientists look at pH solubility to do evaluations of different drug candidates that are entering the preclinical space. So pH solubility is basically done in Britton-Robinson buffers. It's solubility just in a set of buffers that have different pHs. So we do 8 buffers from pH 2 all the way to 9, and we measure the solubility. Again, very low solubility. Filtration plate is a 1x, and we reduce the API loading to 2 milligrams. So here's a set of data that we generated for a pH solubility curve. And as you can see, there are some outliers again, but when you take a look at the average versus the outlier with the outliers removed, they're very similar. Standard deviations of all very good, except for when you get down to the very high solubility. But even that, when you start to look at the percentage, it's not bad. It's plus or minus 10%. That's close enough. That gives us data. So we've compared pH solubility curves that we've generated by hand versus these, and they're equivalent. So we can do this. We've done this probably about 20, 25 times. So the next question is how do excipients affect solubility? So excipients can affect the solubility and the dissolution rate. So what we wanted to look at is to see if we can have a high throughput way of screening excipients effects on solubility. I'm not going to go into all of the different excipients that there are, but they all enhance or do something to the formulation or to the tablet formation process. So this process, we put in 5 milligrams of API and a half mil of the buffer. We do 5 replicates of each condition, and we load between 0 and 7 milligrams of the excipient into each well. So this allows us to track the trend of the excipient and see exactly what that effect is going to be as you load in more incipient. We mix those for about 3 hours at 37 degrees. And if we look at this, we have 2 excipients that really have no effect on solubility, and that's probably expected. We also have one that has a negative effect, so as you load in more of the excipient, the solubility decreases. But we also have one that actually increases the solubility. So this is important for a formulation scientist because you can imagine if you can increase the solubility of the drug in a simulated gastric fluid, in this one, the HPLC increases it 8-fold over not having it there. The dissolution and the bioavailability is going to go up greatly. So this unlocks potential for drugs that may be not very soluble and probably aren't being considered as a clinical candidate, but it's certainly if you can do this and you can do it in a high throughput fashion, you might find spaces that you would never have thought of. So you can also step back from this and say, what if I do combinations of these? So I do full factorial designs and DOEs where I look at and see if we can see combination effects that are intuitive to that. You can look at spaces that you might not even imagine doing if you had to do these runs by hand. So we think this is going to open and unlock a full avalanche of ideals, and we're looking forward to seeing what our formulation colleagues come up with. So we were asked to do a specific project. So we had an analytical development that got stuck on a project that needed to develop a dissolution method that would discriminate between micronized material and nanoparticleized material. So they needed a dissolution method that could actually measure a solubility difference between the two, at least in a 1-hour period. So this was really designed to see if they could do this. They were under the gun. They needed about 6 weeks before they needed to have this method to the FDA, and they came to us and said, Ken, we're going to have to work weekends and nights to get this done. Is there any way you can help us with this workflow? And so what we were able to do is rescreen. Now, you're going to notice that there's no discrimination here, and I wasn't allowed to show you the conditions, but I wanted to really show you part of the data that actually makes some sense to all of us. So we were using different conditions here to generate a difference in the solubility between the micronized and the nanoparticleized suspension. So what we found was that we were able to do that very quickly. In about a matter of 2 weeks, we did about 7 plates for them, and we found one, and they certainly went on. And within about 3 weeks of starting, they had their method, they validated it, and they got it in time for the submission. But what I want to point out here is that Analytical had already started some of this work when we started, and they determined these values by hand, pointing out that we got 25, they got 25, 42, 43, 65, 64, 18, and 18. So we're dead on what they were doing by hand. It took them about a week to generate about 40 points. We generated over 3,000 points in less than 2 weeks. So again, after we did all this solubility workflow, we have about 5 solubility workflows. We've got the question, can you link the polymorph data to the solubility? Now, other people have done this. This isn't new, but I just wanted to show you our approach to that. And we kind of borrowed something that was actually developed in RTP, the metal plate that we used to isolate the solids. And then Stevenage actually used that for their polymorph and salt screening system that they built bespoke to do this. And they used the CIMIC software at the time to integrate that. So the solubility of the, and this is a use case that we're going to do. So the solubility of 2 different polymorphs seem to coalesce over time. So these were a sodium salt and a free acid. And so we would dump them into SGF. And what we would notice is after a period of time, they would coalesce. Now, that's pretty easy to figure out what's going on. The sodium salt is disproportionating as soon as it sees the acid and going to the free acid. Fine, easy. So the other part of this equation is can we inhibit that disproportionation by adding an incipient? So I'll talk about both of the cases that we did here, and Matt actually has a poster out here on this that goes into far more detail than what I'm going to do, and I encourage you to take a look after the talk if you get a chance, because I think it's some excellent work that he did on this. So we would take the compounds, we would mix them in the biorelevant fluid for 4 hours, and then we would isolate the solid and look at the Raman spectra. We also then added HPLC as an incipient to some of the wells to see if it would inhibit the conversion. And so this is the 96 well plate, custom plate that was designed by somebody from GSK. This has HPLC frits pressed into the plate. So you can buy from Alltech these frits, and you place them into the plate, and you press them in. This way, we manually filter these. And this is a ball block. So underneath this is a 96 well vial apparatus that catches the mother liquors as it comes through. So we filter these by hand. Now, we've started the discussions with Freeslate. We would like to put this on the Freeslate deck and use that slurry transfer needle to transfer slurries over there and filter them on deck. So we don't have to do this by hand because it's time consuming and mistake prone. If you put the wrong thing into the wrong well, then you don't have data that's valid. So form 1, which was the free acid in SGF, stays form 1, and here's the reference standard of the free acid. So it doesn't change, and that's not surprising. When you add HPMC into that solution, nothing happens, it stays the free acid. That's reasonable. So in the next study, we take the sodium salt, put it in SGF, it disproportionates, it gives you the free acid. And you can see the reference standard that the sodium salt lies here, but certainly the SGF has converted in 1 hour. But what the surprising form that we found was that when we put HPMC, it disproportionated a lot slower. This is significant because if you have a solubility difference between the two, the dissolution rate difference, these may things that we could exploit in the formulation. Again, I encourage you to go visit Matt's poster because I think that's a tour de force of work that he did on this. So form 1 isn't stable, form 2 is stable. I mean, form 1 is stable in SGF, form 2 isn't, but when you put the HPMC into it, it is stable. So the next piece of work that we did was partition coefficients. So we sit next door to the continuous processing lab, so they were after us very much. So we sat down with Fu and talked to them about how do you measure solubility in a biphasic mixture. It's really no different than what we were doing for the API solubility. You just put the needle height when you're withdrawing it at different places. Now the challenges that are for this is the volume of each of the phases changes over when you add water and things. So ethyl acetate and water, ethyl acetate absorbs 12% water, so you get a volume change. So if you want a mass balance, you have to take some account for that. And what we've asked Freeslate to do, and they've told us they've done it for other customers, is come up with a way that visually it can estimate what the volume change is, so we can then back it to the mass balance. We think once we have that piece of the puzzle done, we will certainly be able to have a very sophisticated way of doing these partition coefficients. So the way we do this is we take the solids, we dispense them into 4 ml vials. We then put 1 ml of each of the phases into it. We stir those for a couple of hours, and then we do a brief centrifugation just to break any emulsions that would form, and then we basically do the solubility workflow that we've been doing before. So we take each sample, we dilute it to 10x and 100x, and here's some preliminary data. Now this is the first partition coefficient that we did, and we artificially took 5 milligrams and dissolved it up in acetonitrile and then backed it back down and then added these phases and measured the solubility. So what you see is that we're not getting very good mass balance. And what that is the problem is that we don't have any measure of what the volume change is. Once we had that and we started to think about that, it makes sense. We'll certainly get the mass balance, but we need that piece of the puzzle to make this complete and complete the loop. So the last thing that I want to talk about today is reaction kinetics. And as I said before, using a CM3 to do reaction kinetics is probably not the most elegant use, but we certainly wanted to demonstrate that we could do it and show the chemists that the Freeslate can do this. So what we did was we did a reaction where at room temperature nothing happened. So we pre-made the reaction mixture and dispensed a ½ milliliter to each of the vials. We then sealed the plate up, put the magnetic stirrer in, stirred it, and heated it up to 70 degrees. We then sampled every 4 minutes for the first hour and then an hour on the hour after that. Now the strategy that we used there is that each vial was a single reaction and was only sampled once. So T equals 0 would be basically A1, 4 minutes later would be A2, and so on. Because what happened at 70 degrees, as soon as that needle pierced the septa, it would get solvent coming, boiling out, and after a short period of time, that vial would be dry. So that's the inelegant way of doing this because you're really using a lot of space on the Freeslate to get one sample at time point. And again, we'll do the same approach on the iChem, which is much cheaper and certainly is in less demand. We'll have 8 of those systems up and running shortly. So we'll be able to generate the samples on the CM3 and put them on the iChem and run them. So we used an internal standard of naphthalate. This was just basically allowing us to get a normalized area %. So here's the data that we got out of the reaction kinetics. So here you see the starting material become decay, exactly what we thought it would be. The product then comes up, and you see a low level of impurity that goes, and it slowly increases to where it starts to ramp up a little bit. The second impurity, you don't start to see it until about 12 or 13 hours, and what you see there at that point is it starts to rise up very quickly. So what you see is a tail off of the normalized area %. So what the chemists can take home from this is this is the place that they probably want to stop the reaction. It also gives them a window of what time frame do they have to do that in the factory. So if they know that they need to stop it at 10 hours plus or minus 2 hours, they know the time frame that they can do it and they can plan around the shift changes. So I've talked today and showed you all the work packages that we've demonstrated, but I wanted to share with you sort of the volume of work that we're starting to do here at GSK. So the laboratory has 2.5 people, and I count as a half. Matt and Chris are certainly full-time in the lab, and I'm very lucky to have such talented people working with me. But we've done 7,100 experiments in the first quarter. So if you think about that, that's about 78 plates. What we're doing is we're averaging across the vehicle about 75% utilization for both of those CM3s in the first quarter. That's pretty good. That's a really high utilization rate. If you look at GSK and automation, utilization rates are never above 50%. So we have also gone and looked at, and management asked us to say, well, how much time are you saving? How much FTE time does it take to complete one of these experiments compared to what you would do manually? And so on the back of an envelope, we actually went and did 96 manual solubilities and measured how long it would take us to do that. And what we think was we're about 5 times more efficient using the automation than we would be manually. This is going to drive a lot of decisions in our business because now we can free up the scientists' hands to actually start doing intelligent design. Instead of spending all their time measuring solubility, they can think about sophisticated DOE kind of studies in solubility where they'll allow themselves to really explore spaces that they would have never gone. So where are we going to go in the future? We're certainly going to go towards, I think, the OSR reactor on the MIPS system that we presently have. We think that will expand it, and we're really excited to have that possibility. And I think more formulation DOE kind of studies where we do multifactorial kinds of designs where we do hundreds of plates. These are going to be quality by design in the late phase kind of work. We also think in the chemistry space that using Freeslate to do 96 well plate screening in the chemical space would be able to do the same kind of work. So all of these studies are really preliminary. We've only begun to get done what we would like to do. We've been working about a year. We have 3 CM3s and a protege, or a half a protege. But the key for automation experts is to work with customers, not work for them. So what I tell people when they come to start to collaborate with us is that we're not a drop and dash service, that we don't want our scientists to say, here's our compound, give us the data, we don't want to be involved with anything. What we want them to do is come into the laboratory, understand the automation, and interact with us so we can collaboratively design things that make sense for them and that they get the data they want. And I think that's been a really successful model. It's starting to bear fruit. In fact, the management has basically said that we're going to take 3 people from the business and embed them in the automation full-time for a year to establish them as sort of a resident expert in each of their areas so they can go back after that period of time and be sort of the disciple, sort of the, fair, that leads the way for people to come here. So with the management support like that, I think we're going to go into spaces that we really can't even imagine right now, and I'm really excited. So I need to thank the people that work with me. Matt and Chris are certainly the driving force. These young men are just truly astonishing with the amount of work and how quickly they pick this up and the enthusiasm they bring to our laboratory. We've had 2 interns, Dan and Sophia, who also have been incredible. Dan took the Quantos and turned it into a system where chemists were interacting on a daily basis. And it was really phenomenal to see his progress through his co-op. I also have executive leadership that I think has been fundamental. And if I was to say anything to people out in pharma that wanted to reproduce sort of the success that we're having, is you have to have that executive leadership with vision to actually make this go. Because at first there's resistance to change of how they do it. People don't want to go into automation because they say, what I'm doing right now works. Why should I do this? And having executive leadership that actually goes in and says, okay, you're going to do this. You're going to come back to me, and not I'm going to force you to do it, but you're going to go and look at it, run it, see what it is, and then come back to me and tell me why it doesn't work or why it does work. And in every case that's happened, the people have gone back to their business and said, this is phenomenal. So it's key to how we do everything. So lastly, I want to thank all the customers that have trusted us with their project. I really think that we have this interactive vibe that's going on in the laboratory where people like to be around us and really be there and working with us. And I want to thank you all for your attention today, and thank you. Yeah, so the variations are the incipients you put in there, right? So you can do multi-things. And also, I didn't touch on it, but so you have API that hasn't been granulated, but then you can granulate it with the incipients. And what we see is differences between if you just mix the incipients with the API versus granulated material that you have and you put in there. The dissolution rate and the solubility, at least initially, is different. So those are all factors that we haven't even started to go down. And certainly, we actually, this last couple of weeks, actually took tablets and put them in and stirred them in like a simulation vial and started to measure solubility and dissolution over that. So there's a whole world that we are ready to go at. Yes, the short answer is we have tremendous interest from them. So from the very top leadership of GSK, they've come down and said to them they need to think about the ways to automate generating hit to lead and also lead optimization. So those things, those discussions are going on like right now, so it's very relevant. We're in the birth of that, though. We have only just started to say, okay, what do you want to do? How do you want to do it? And those kinds of things. Yes, and we're at the soul searching stage, I would say. Great people working with you and management support. And I will also, and I forgot to say this and I wanted to say, our success would not have been possible without the support of the Freeslate organization. From Prue to Justin to Vivian, those people have been phenomenal. We literally can email them and get an answer back in about 20 minutes. They're phenomenal in supporting us. And I really think that's the key differentiator between Freeslate and other automation makers is the level of investment that they've made in our success has really truly driven that. And I thank you, Steve. I mean, your organization's phenomenal.